Thank you for inviting me to talk today. My name is Jillian Zitars, and I am a master's student in the clinical psychology program at Lakehead University in Ontario, Canada. I would like to acknowledge my supervisor, Dr. Deborah Scharf, who assisted me in my presentation and is the principal investigator in the research that I will be talking about today. So for my presentation, I was asked to address my perspective on health and human rights, how I came about to this perspective, and how it is informed by my work. So I will start off by telling you about Thunder Bay, Ontario, where Lakehead's main campus is and where I currently reside. So Thunder Bay, as you can see on the little red star on the map, it is a geographically isolated city in northwestern Ontario with a population of just over 109,000 people. Any major city is about an 8-hour drive minimum to get there from here, so fairly isolated. So Thunder Bay serves as a hub for northwestern Ontario, with many of our health and social services serving a geographical area the size of France, and that area includes many remote Indigenous communities. So due to the relevant remoteness of Thunder Bay, we are unable to refer individuals to nearby cities for services that we may not have or that may have a long wait list. So thus it can be difficult for our community to provide services to our residents as well as for our residents to access services. Furthermore, Thunder Bay has a significant Indigenous population compared to Canada as a whole. So about 3 times that of Canada as a whole if you're looking at percentages. And so it is important that the services we provide here are culturally appropriate to meet the needs of our significant Indigenous population. So remote and rural communities face unique barriers and heightened barriers to accessing mental health care, especially mental health care that is appropriate and meets the needs of the community. So health and human rights means understanding these issues and addressing gaps in mental health care in order to provide high quality healthcare access across the country. So this leads me to my next point, which is it is important to serve individuals across the whole mental health continuum. So my past research before I came to Lakehead focused on well-being promotion in employee populations, and my current research focuses on mental health crisis response, so both ends of that continuum. And both these research topics have impacted my understanding of health and human rights. So it is important to promote mental well-being in healthy populations through mental health promotion and prevention. It's also important to support individuals along the mental health continuum and important to treat those experiencing moderate to severe mental health disorders or mental health crises. And similarly, it is important to invest across the mental health continuum. But however, due to our fragmented mental health system that we have, individuals are missed along the mental health continuum. And so these are even folks who are struggling with severe mental illness or those who frequently experience mental health crises. And these individuals may be forced to wait until their issues reach higher severity or to pay out of pocket if they don't have private insurance that can cover mental health care. And so we see disparities also in mental health care access across the continuum about when can an individual access resources. And so we need to improve access to and the appropriateness of mental health care across the continuum. Crisis response is one piece of this. So when an individual is in crisis, we need to respond appropriately according to their assessed need. So this means early intervention if possible to avoid safety and welfare concerns, as well as providing appropriate support if safety and welfare concerns arise, assisting these individuals in the stabilization period during a crisis, and providing follow-up support if necessary to prevent future crises. And so we want to have a comprehensive approach that addresses individuals' needs. Within the safety and welfare response are mobile crisis intervention teams, which is what my research focuses on. And so mobile crisis intervention teams, or MKITs, are one approach to mental health crisis response. So due to the safety and welfare concerns that often accompany mental health crises, police are commonly the first to encounter individuals when they are experiencing crisis. However, they are not the most appropriate to be responding to these folks. And when someone is in crisis, we want to make sure that we can meet them with the level of care that they need, and ideally out in the community. And so MKITs pair a police officer with a mental health professional to appropriately respond to these calls, with the primary goal of providing higher quality care with more appropriate response to individuals experiencing crisis. And this is through assessment, support, and intervention. Furthermore, these teams aim to divert individuals from emergency departments and jails through referrals to community-based resources, such that it is less restrictive care, which is also more cost-effective, and that allows individuals to remain with their natural supports in their environment, and can emphasize self-advocacy. However, these programs are very heterogeneous in how they are realized in different communities. So beyond just this co-response piece, hours of operation can vary, the vehicles and appearance of the teams, how calls are triaged, all this can vary, which makes it hard to research, and there's not like a clear path on how this is implemented. And then also, furthermore, this model was created and tested in large urban centers, much different than our community. So our current research project examines the MKIT in Thunder Bay and how it adapts the mobile crisis intervention team model to meet the unique geographical, demographic, and resource factors of our community. Through this project, I have become aware of the unique skills that psychologists can bring to MKITs. So while psychologists are unlikely to work frontline on these teams due to resource constraints, billing issues, and the overall availability of psychologists, they can work in partnership with MKITs, so both administrative staff and leadership, and thus having impacts on a multitude of groups and people rather just in one-on-one settings. And so some of these unique skills that psychologists can bring to these teams are risk assessment, knowledge of culturally appropriate care, knowledge of program evaluation, and so being able to look at the services and the teams and how to improve these services, clinical skills that they can help frontline staff with, knowledge of community service networks for targeted referrals, as well as the ability to provide services to staff if they're experiencing burnout or mental health issues. And so partnerships between MKITs and psychologists can help improve the services provided by these programs, as well as the well-being of staff. So therefore, my perspective on the role of psychology in health and human rights is that we need to support individuals across the mental health continuum and provide high quality care that meets the needs of all individuals, regardless of where they reside and the different cultural or social groups that they are a member of. Thank you.